Hi and welcome. I'm trying to learn medicine. Today, Amnesia, and after that, Amnion, and after that, leg injury prevention training. And if you participate in the leg injury prevention training, that is at your own risk. I'm talking about internal anatomy. Yes, mostly that. And this is no medical advice, we're just reading about it. Amnesia, this is part 2 of amnesia. Loss of memory, either partial or total, that is so pronounced as to cause worry or problems for the sufferer. Maybe just gonna use the word severe, and people understand that they don't just mean forgetting the word for something. Okay, partial or total severe memory loss. It can be caused by a head injury and indicates the presence of concussion. It can be caused through a head injury and implicates concussion. Indicates concussions. By the patient's emotional states such as hysteria, or by a number of illnesses including, it can be also during someone having the emotional state of hysteria, maybe we express it like that, and other illnesses like alcoholism, meningitis, syphilis, brain tumor, and epilepsy. Alcoholism, meningitis, syphilis, brain tumor, and epilepsy. Alcoholism, epilepsy. Let's try to have them all. Alcoholism, meningitis, syphilis, brain tumor, epilepsy. Okay. Let's go on. In retrograde amnesia, the victim loses his or her memory for events that happened before some injury or emotional shock. In anterograde amnesia, the loss of memory is for events that happened afterwards. Okay. Retrograde, before. Anterograde, for memories happening after an event of injury or emotional shock. Let's try to mention that clearly there, but we have it somewhere mentioned as well. In many cases of amnesia, the patient's memory returns with the passing of time or with the clearing up of the underlying condition. Okay, we try to say both things. In many cases, let's use many cases, the words here also. In many cases, let's try to use many. In many cases, the situation clears up. In many cases, the memory returns with passing of time or with upclearing of the underlying condition, or when the underlying condition goes away. Okay. But if the cause is emotional disturbance, this could mean that the mind subconsciously wishes to erase some occurrence that is too distressing to contemplate, and psychiatric help is needed. Let's mention it somewhere at the end. If the cause is emotional disturbance, if the cause is emotional, and if the cause is an emotional disturbance, it could be that the mind tries to erase or forget a memory, subconsciously. Tries to erase or forget. Maybe we should mention actually the name subconsciously. If I understand correctly, it means not consciously, so not try to do it. Subconsciously to erase an occurrence. Maybe psychiatric help is needed. Okay, I think I have it all together. Amnesia is total or partial severe loss of memory. It is oftentimes, it can be caused through a head injury and can implicates or indicates a contact. There's a difference. It implicates a concussion, and it can be also it can be also if someone has a state of hysteria, or as part of other illnesses like meningitis, brain tumor, epilepsy, alcoholism, and syphilis. And yes, the thing it returns. Retrograde injury. You make to the whole thing. And there's retrograde anemia, that is when the events before the head injury or whatever happens, or the emotional shock happens, I forgot, or anterograde when the events after it. And If a cause is emotional disturbance, then it can be that the mind tries subconsciously to erase an incident and maybe psychiatric help is needed. Let's try to make it. I have a second camera. Amnesia. Amnesia is partial or total severe memory loss. It can be caused through a head injury and can implicate a concussion. It can be also if someone has the emotional state of hysteria or along of other diseases like alcoholism or meningitis, syphilis, brain tumor or epilepsy. There is a retrograde amnesia where the events before the head injury or whatever or emotional shock happening are forgot, retrograde before and anterograde afterwards the events are forgotten. If the cause is emotional disturbance, then it can be that the mind tries to subconsciously erase an incident and then maybe psychiatric help is necessary. And this is according to Keith Hodgkin's Family Medical Advisor book, page 71, but this is no medical advice. I'm going to stop the camera. And we are running. Amnion. Yeah, we're talking a bit about internal anatomy. Amnion, the membranous sac which encloses the fetus in the womb. Okay, that is the membranous sac. Is it on? Maybe we get it a bit better. Inside the sac, the fetus floats in and is concussioned. Is cushion. Concussion. But here it's written with SH here. CUSS. And it is very softened so that it does not get a concussion. And is cushioned by a liquid called amniotic fluid. Okay, nothing else written where it is now exactly. So the amnion is the name for the membranous sac inside of which the uterus is during pregnancy. Inside which the fetus is during pregnancy. I think it's the other way around, but I don't really want to talk about it because I don't know that I don't want to say it wrong. I think the uterus is to the outside and the amnion is on the inside. And in that is the amniotic fluid with the fetus. Now, the bursting of the amnion and release of the fluid usually signals the beginning of childbirth. Okay, the amnion is bursting and now this amniotic fluid is coming out, and that usually, if it happens at the right time, means that the child is shortly before parturition. When there is a risk that a fetus may be suffering from spina bifida, Down syndrome, or a rhesus vector problem, or one of certain other abnormalities, a sample of amniotic fluid is withdrawn from the womb through a hollow needle, amniocentesis. The cells of a fetus in the fluid are then examined for evidence of the abnormality. Now, the book is from the 80s. Maybe some things are already better known, but they're saying here that there is the possibility, the medical possibility of an amniocentesis, and there through a hollow needle, a bit of the amniotic fluid is extracted to analyze it. Okay, we could actually do it. The informations are not that many, but we want to do leg intervention training. That means we're going to do a second part to Amnion, and where we try to make a presentation just as we did it to the Amnesia. That was the medical part. If you were here for medicine, you can go directly to the next part of medicine. We're going to do now the leg injury prevention training. If you stay and participate in the leg injury prevention training, please let it your risk. We are standing good on one leg and we're swinging the other leg with a flexed foot in the front and to the side. And the other leg swinging in front and to the side. And again, Something similar. One leg comes in front and back. And one for the front and back. And now to the next exercise. Bring one leg up and the hands out. The direction way, breathe in. And out and go with the hands over to one side. Into the middle and over to the other side. The middle and now over with the hands to one side and with the leg over to the other side. The middle and down and down. Now, other leg up, hands out, and go with the hands over to one side. And to the other one. So middle and both over. Both over. And down. And now breathe in, lift the leg up. Pine pilcrow. Breathe out to the side. Breathe again in. Out into the middle and down. And the other leg up. Breathe in. Out to the side. Breathe again in. Out into the middle and down. And now the next exercise. Which one? The wildcatter. Stand good on one leg. Turn over to the leg. This exercise can go to the knee. Go down. Turn over to the other side. And come up again. Maybe a bit slower. Stand good. Turn over to that leg. Go down. Turn over to the other side. And come up again. And with the other leg. Stand good. Turn over to that leg. Go down. Turn over to the other side. And come up. And another time. Stand good. Turn over. Go down. Turn to the other side. And come up. And now this is a leg up and press with the knee up and to the side. Other leg up and press with the knee up to the side. And now the clock. Stand good. This can go again on the knee. Stand good on one leg and go and to all the 90-minute intervals on the clock style. Go every time a bit down with him. And now with the other leg. Go to 12 o'clock and 1:30 and over to 3 and to 10:30, 9 and also to 7:30, 6 and 4:30 and 3. And now the next exercise. The pad. Don't do it if you're pregnant. Have a good standing leg. The other leg with the heel onto the ground and put that heel off the ground and place it on the ground. And on the other side, heel onto the ground, lift that heel off the ground and place it again on the ground. And now, a step, leg up and again down. Other leg up and down. And next exercise, one hand on tummy, one on lower leg, and lift the leg in a straight line up. If the quad muscles cramp, then pull the leg up and point with the toes down. So bring the leg up. Control with the hands, but you don't fall back. Flex foot, try to bring the leg higher. And pull the leg up, point with the toes down, and relax the leg. Other leg. One hand on tummy, one on lower back, and lift the leg up. Control with the hands, but you don't fall back, and try to bring the leg with a flexed foot higher. And pull the leg up, point with the toes down, relax the leg. And let's do the horse. Leg in and out, and in and out. And with the other leg in and out. And the ending. Last exercise, legs wide apart, breathing around. And breathe out. Out. Breathing across the legs. And breathing out. That was the
leg injury prevention training. I think very much into mix.